Good afternoon, everybody. Today we are going to discuss something about prevention of heart disease. What we all know that coronary artery disease is growing almost by leaps and bounds, and almost we are in the midst of epidemic in India. Besides hypertension, diabetes, obesity, and other non-communicable disorders are also increasing, and these are leading to complications like heart failure. So we have to understand what are the mechanisms by which we can prevent these forms of illness, and this is particularly by lifestyle intervention, which includes proper dietary arrangement. One has to avoid excess of calorie, excess of oils and fatty foods, saturated fat containing food like mutton, etc. Rather, one has to focus towards fruits and vegetables and restriction of calorie. And diet should only be, not only one should look into the types of food one is going to have, one has to go to quantification and appropriate timing. Besides, one has to take adequate exercise. For a grown-up person, it all depends upon the physical ability of the person. Of course, on an average, if the patient is fit enough, he should take at least 30 minutes of exercise, like brisk walking, 5 days a week. One should not smoke. Stopping tobacco is essential, and one has to know the digits of his body, like the blood pressure, blood sugar, cholesterol, etc. And blood pressure has to be kept within narrow range, below hypertensive limit. Like it is good to have a BP around 130 by 80 or 120 by 80 if the patient tolerates it. Of course, we all know the level of BP is often determined by associated problems and age, etc. Blood sugar has to be kept in the non-diabetic range. Pre-diabetics have to be tackled with equal aggression as well as a diabetic, and one has to try to keep the fasting blood sugar below 100. For that, appropriate dietary modification, exercise, etc. are important. Besides, cholesterol estimation is necessary. Everybody should undergo a lipid profile estimate after the age of 40, and LDL target should be below 130 on an average person. Of course, if he is having more risk due to presence of other illness, this may be below 100 or even below 70 in a very high risk person. And in those patients, again, dietary modification and exercise, and with that, if necessary, statin in adequate dose has to be taken. So, in essence, prevention of cardiovascular illness means knowing the problems, knowing one's own body, lifestyle modification, and if necessary, taking appropriate medication. In our country, salt is required a bit more than the Western countries, but even there, one should not have more than 5 grams of common salt per day. Thank you.